In the previous video, excuse me, we already discussed the theoretical analysis for the brain tumor surgery example. Now here we're going to continue with several pieces of empirical evidence and the policy implication. Okay? I'm not sure if you ever thought about these, like why we need to think about or talk about the brain tumor surgeries. Okay, most of us, I bet, during our lifetime, we won't have any, kind of the brain tumors, or even the friends and relatives and family members, they won't have this issue at all. Okay, because the chance of getting a brain tumor is pretty slim. But we use this just as an example to show you a bigger issue in this country, which is the healthcare reform. Okay, over the years or decades, we keep receiving more and more crazier medical bills. Okay, these dollar amounts on the medical bills are just went totally out of our expectation. Have you ever thought about why? How we got here? What's the fundamental issue on this market? Now, by looking at this three-step analysis, we should already get some insights about this. Okay. First of all, the inelastic demand. That means the moment when we look at the surgeries like these as a necessity, we lose our bargaining power. In other words, on this market, it's not a level playing field. Okay, so once we were told we got a brain tumor, we need the surgery, we just want to get it done. Okay, and we put the money way behind our health, right? But again, oftentimes we won't shop around, like when we buy a coffee maker or buy other stuff, right? Or even sometimes we won't pump gas. We would compare the prices, among a few gas stations at a crossroad, right? But oftentimes when it comes to the surgeries where we spend tens of thousands of dollars, we don't really shop around. We don't ask it around. Okay, and so that's why we believe this is not a level playing field. Okay, and because of this inelastic demand, we find that the price is higher or way higher, and the quantity, the decrease in quantity is smaller. Right now, let's check out some empirical evidence, and then we're gonna look at the solutions. Okay. Now, the first one, we look at these healthcare insurance premiums. Okay, and the dark blue one here is a worker's contribution to the family premiums. So, for example, if you work for our college, okay, and every month when you receive your paycheck, you would find that several $100s have already been deducted because they goes to the family health insurance premium. Okay, but that's actually not the total cost. So the college, as the employer, would also pay a portion of the insurance premium. Okay, so that's why we got the orange line here, health insurance premium for family coverage. In other words, this is a total cost, okay, and including the employees and the employer's contribution. Now, we also show you the light blue one, which is all workers' earnings, so how fast our income has been growing over these years. And the fourth line we see is the overall inflation, so that we can compare our healthcare spending, or health insurance spending with other goods and services spending. Okay, now you find that in 1999 everybody equals 0 because again what we're showing on this chart is the growth rate, okay, the cumulative growth rate. All right, and you would find that the overall inflation went up by 42% over these 16 or 17 years. Okay, in other words, something was worth $100 in 1999. Now, in 2016, it should be worth $142. Okay, and the earnings went up by 56%. Okay, but look at the workers' contribution to the family premium. It went up by 221%. In other words, it tripled, okay, compared to the level in 1999. Okay, it went up way faster than the prices of other goods and services around us. It went up way faster than our income. So that means we keep spending more and more portion of our income towards the health insurance premium, okay, which is pretty much consistent with what we just found with the three-step analysis. Because the prices are higher, so the insurance premiums are higher, so we have to pay more every month, right? The second piece of empirical evidence is a cross-country comparison. Okay? This one is interesting because here you would find the United States on the far left. Okay, so altogether we actually spend in the year 2016 we spent $9,451 per person, okay, on healthcare. And because this data is several years old, so you should expect this number already went beyond $10,000 bar. Okay, and then you find other countries, especially the OECD countries. OECD means Organization of Economic Cooperation and Development. So this is a group of rich, developed economies. In other words, we're not comparing United States with India, with China, with some African economies. Okay, we're actually comparing United States with Germany, with UK, with other European economies. Okay, with a similar income level per person. Now, if you look at this red bar here in the middle, that's an OECD average. They actually spend $3,814 per person, way less than what we spent. And if you look at the UK here, you would find that we use a laser pointer. UK, they actually spend slightly above $4,000 per person. In other words, in the United States, we spend $5,451 more, okay, and per person every year. Now, if you said that we paid more because we received a much better or more quantity healthcare treatment than people living in Iraq, for example, or in Zimbabwe, I think that makes sense, right? But if you want to argue that the medical treatment we received here is much better than the British people received or Germans received, I won't buy it. Okay, you can make your own judgment. Okay, or do you really believe the gap between the quality of the healthcare treatment among these countries are really this big? Okay, so this is the second piece of the evidence. The third one, I got this from the Healthcare Cost Institute. Okay, and there are a lot of information on this chart they made, but I really want to drive your attention to this box on your right-hand side. They said our spending growth, the healthcare spending growth, was driven primarily by increases in the prices paid. Again, the same thing we found in three-step analysis, right? For all major service categories, the increases in prices paid were driven by increases in the underlying unit price. In other words, you cannot say, Americans pay more every year towards the healthcare because we see doctors more often, we receive more surgeries, more treatments than, our counterparts in Europe. This is not true. What they're saying is it's just per doctor visit, per surgery, per treatment, we pay more. Okay. All right. Now, here, what's the solution? We got to go back here and look at this. Okay. Now, this is a hotly debated issue. Okay. Among Republicans, they always said that, the solution should be free this market and remove all the barriers on the market so that we will get more hospitals, more doctors joining the supply side. So if that happens, then we're supposed to shift the supply curve to the right. Okay, remember this is a number of centers. Okay, so if we shift it to the right, then we may end up with a lower price and more quantity. Okay, perfect. Nothing could be better than that, right? But Democrats would say, no. Even when we have more hospitals and doctors, we still face this unlevel playing field. Okay, so the issue is still there. It's still, we still have the inelastic demand. Okay, and so what they are saying is Democrats want the government to come in and sponsor or finance the whole system. Now, they believe that once the government comes in, they represent at least the majority of the patients, so they get more bargaining power. Even though we still know it's a necessity to us, but because we come as a group, okay, so we have a more bargaining power that could help us reduce the cost of the healthcare treatment. And they get a pretty supportive evidence on this chart, because again, when you look at Europe, most of these countries, including UK, their healthcare systems are government sponsored, government financed. Okay, so the government gets the data, they know the real cost of these treatments, they can push the doctors and hospitals to reduce the cost. Okay, so the problem, again, the judgment, you can make your own judgment, like which one makes sense, Republicans or Democrats. Okay, probably we have to do both. Okay, but of course, in terms of the whole system, it should be government sponsored or it should be privatized even more. That's controversial. That's contradictory. Okay, you cannot do both. But one thing we have to do is to make things more transparent. Okay, in these days when we see the doctors, again, we just want to know, like, if we have to receive a surgery, we just want to know when we can receive that, right? As soon as possible. We don't even argue or bargain the cost. Okay, but in a functional market, what should happen is people shop around. Okay, and the precondition of shopping around is the prices got to be transparent. Okay. However, in these days, when we ask or try to ask the cost of a surgery, the answer we got is you go and ask your insurance company, right? And sometimes they would say, there could be a lot of complications, so the real cost is hard to estimate it before the fact. Okay, so again, that makes us more challenging to shop around. Okay, and what we find is in reality, not just among the patients, but even the doctors or hospitals, they don't know what their competitors are charging on the market. They just know what they are charging, but they don't know what other doctors and hospitals are charging for the same medical treatment. Okay, so the whole market right now is definitely dysfunctional. Okay, and there are some studies out there showing that even for the standardized blood test across the country, the lowest cost could be just $20. Okay, but the highest could go over $150 again for the exactly same service.